Well, thanks so much. It's really fantastic to be part of this, and I actually wish I could start my career all over and try one of these other options. The theme for my little talk is going to be the letter D. Okay, so I want to talk a little bit about disease detectives, also called Epidemic Intelligence Service Officers. And outside, there's a little thing that looks like that has more about that. And the reason I'm picking the letter D is because the issue is delay. So I'm an internist, full disclosure. And I was chief resident, and I was training at the Manhattan VA hospital in New York City. And I loved medicine, and I loved my patients, and I loved the VA. And it was the mid-1980s, and a third of our patients had AIDS, and it was, emotional, intellectual. It took all of me, and I loved what I was doing. But apparently you can't be chief resident forever, and you eventually have to leave that post and do something else. So as I got the applications for fellowships and jobs and everything, I just was sort of in a lull and managed to talk to one of the infectious disease attendings about my desire to just delay life plans and decision-making. And she suggested, oh, have you ever heard of the Epidemic Intelligence Service? I said, oh yeah, I actually had vaguely heard of it during med school, but had forgotten. But for me, it was this great opportunity to delay. So I didn't have to make any life plans, figure out my whole long-term idea, but thought, oh, that sounds fun. It's 2 years, you go to Atlanta or you go to a state, and you work on whatever comes up. I actually matched, they have a little match for it. I matched in the meningitis and special pathogens branch at CDC and got to sort of plop into this group that was doing fantastic work, got assigned a batch of projects, got to go to Costa Rica on an outbreak investigation of newborn listeriosis. Big mystery, was able to pin it down to the mineral oil that they were bathing the babies in that got contaminated during a messy birth of a woman who had early onset listeriosis in her baby, and all these babies had late onset disease. Got to do a big national case control study of sporadic listeriosis that helped show foodborne causes of sporadic disease, and we were able in our team to have a finding that led the USDA to make a change in national food policy. So they didn't allow Listeria monocytogenes in ready-to-eat meat anymore because of our study. So the third D, I guess, is decisions, and I really liked the idea that public health and epidemiology helped influence important decisions. In that case, a national one that led to about a 30% drop in sporadic listeriosis. I also got to work on a lot of different vaccine issues, and I was an EIS officer at the time that we were just starting to use the Hib conjugate vaccine, and it was just starting to be used in toddlers, but we started to see this incredible effect in infants. You probably know that story that that vaccine ended up interrupting transmission. And so even before it could be used in the youngest age group, it was having an effect on that group just by the 18-month-olds that were getting vaccinated. Got to see that same story pan out with pneumococcal conjugate vaccine as well. So that idea that the work of public health or epidemiology involves results that end up having an influence on national decisions, sometimes international decisions, that can influence a lot of programs, practice, and ultimately people's health. I was a very nerdy person in my life. So, all the way through my education, nerdiness is kind of who I am inside. But I'm also a social person, so I liked Susan's comments about how important that social environment was to her career happiness. I think in public health and at CDC in particular, it's really this marriage of the nerds with the social people. And you're able to use that analytic, intellectual, deep thinking skill set, but for purposes that have a greater meaning. So I think just the last couple things to say. My EIS experience was extraordinary. I got to work on all kinds of cool things, started my groupie strap career at that point, delayed having to have a life plan, and ended up getting to stay at CDC for a pretty exciting career. But when I've analyzed what's important to me in a job, as I've like this new job I have as deputy director. Why did I give up my old perfect job for this new job, which has a lot of headaches? I said there are three things I really need, and one of them is I need to be useful. Second thing is I need to be challenged, and so the one thing about my old job, which I absolutely loved, is I'd been doing it for 10 years, and it was kind of time for a new challenge. And then the third thing that's really important to me, for my personality, is that I can be creative. And that's not usually what you think of in a medical job or a physician assignment or a researcher, but for me, I've been able to have creativity be at the heart of my work, so that's something for my personality that lets me express myself, something that I didn't really find when I tried bench research in college, but and certainly not on the wards where you can't be too creative in how you treat a patient. But I think in terms of public health and having ideas that I could see come to fruition, it's been a place for me. So that's my few minutes of why I like what I'm doing. And you can ask me later what I don't like about what I'm doing.